Your eyes are showing you a warning sign right now, at this very moment, that could predict a heart attack, a stroke, or vision loss years before it happens. And most people over 50 have absolutely no idea that when they look in the mirror, when they see certain changes in their eyes that they dismiss as normal aging, their body is actually screaming at them that something is seriously wrong with their circulation, their blood sugar, their cardiovascular system. By the time vision actually starts to fade, by the time you notice you cannot see as clearly as you used to, irreversible damage has already been done. But if you know what to look for, if you understand what your eyes are trying to tell you, you can catch these problems early when they can still be prevented or reversed. My name is Dr. James Harlow. I have been practicing general and preventative medicine for over 20 years, and I can tell you without exaggeration that your eyes are one of the most powerful diagnostic tools your body has. What most people do not realize, what most doctors do not have time to explain in a standard appointment, is that your eyes are the only place in your entire body where blood vessels can be seen directly without surgery. When I look into your eyes with an ophthalmoscope, I am not just checking your vision. I am looking at the health of your arteries, your circulation, your blood sugar control, your blood pressure. Everything that is happening in the blood vessels throughout your entire body is reflected in the blood vessels in your eyes. And there is one specific warning sign that appears
Appears in the eyes of people over 50 that predicts serious health problems years before those problems become obvious anywhere else. Let me tell you about a patient I saw just 2 months ago. Her name was Helen.
69 years old, retired accountant. She came to my office for what she thought was a routine eye examination because she needed new reading glasses. She mentioned casually that over the past year, she had been noticing small dark spots in her vision, little floaters that would drift across her field of view, especially when she looked at something bright like a white wall or the sky. She said they did not bother her much. She thought it was just part of getting older. She had read online that floaters were normal and nothing to worry about. But when I examined Helen's eyes, when I dilated her pupils and looked at her retinas with my ophthalmoscope, what I saw alarmed me immediately. The blood vessels in the back of her eyes were damaged. I could see areas where the vessels had leaked, creating small hemorrhages. I could see where new abnormal blood vessels were trying to form to compensate for poor circulation. I could see swelling in her macula, the central part of the retina responsible for sharp, detailed vision. Helen had diabetic retinopathy, advanced diabetic retinopathy, and she did not even know she was diabetic. We ran her blood work that afternoon. Her fasting blood sugar was 240 milligrams per deciliter. Her hemoglobin A1C was 9.8%. She had uncontrolled diabetes that had been damaging her body for years, maybe a decade or more. And the first place that damage showed up, the first warning sign her body gave her, was in her eyes. Those floaters she thought were harmless, they were tiny hemorrhages from leaking blood vessels in her retina. Her body had been trying to warn her for at least a year, but she did not know what she was looking at. She did not understand that floaters, especially new floaters that appear suddenly or increase in number, are not just normal aging. They are a warning sign. Your body is trying to tell you something urgent. Now, if you have noticed floaters in your vision, especially if they appeared recently or seem to be getting worse, I want you to write the word seeing in the comments right now. And if this is the first time you are learning that changes in your eyes can warn you about diabetes, heart disease, and stroke before you have any other symptoms, write eyes below. I read every single comment, and I want to understand how many people are experiencing these warning signs so I can make more content that helps you protect your vision and your overall health. And while you are down there, please make sure you are subscribed to this channel and that you have liked this video, because this information could save your sight and potentially your life. Let me explain what is actually happening inside your eyes and why the changes you can see or the changes your doctor can see during an eye exam are so critically important for your overall health, especially after the age of 50. The retina is the light-sensitive tissue at the back of your eye. It is essentially an extension of your brain. The blood vessels that supply the retina are tiny, delicate arteries and veins, some of them thinner than a human hair. These vessels need to be incredibly healthy to deliver oxygen and nutrients to the retinal cells that allow you to see. When something goes wrong with your circulation, when your blood sugar is too high, when your blood pressure is elevated, when inflammation is damaging your arteries, the blood vessels in your retina are among the first to show damage. High blood sugar, the kind you see in prediabetes and diabetes, damages blood vessels throughout your entire body. But the damage shows up earliest and most visibly in the smallest vessels. And the smallest vessels in your body are in your eyes, your kidneys, and your extremities. When blood sugar is chronically elevated, the excess glucose in your bloodstream literally changes the structure of the blood vessel walls. The vessels become weak, they become leaky, they develop tiny bulges called microaneurysms that can rupture and bleed into the retina. Your body tries to compensate by growing new blood vessels, but these new vessels are abnormal, fragile, and they bleed even more easily than the original damaged vessels. This process is called diabetic retinopathy, and it is the leading cause of blindness in adults. But here is what most people do not understand. Diabetic retinopathy does not start the day you are diagnosed with diabetes. It starts years earlier, when your blood sugar is elevated but not yet in the diabetic range, when you have prediabetes or insulin resistance that no one has detected yet. The damage is accumulating silently, invisibly, with no symptoms at all, until one day you notice floaters, or you notice a dark spot in your vision, or you notice that straight lines look wavy, or you wake up one morning and part of your vision is just gone. By the time you have visual symptoms from diabetic retinopathy, the damage is often severe and irreversible. But if you catch it early, if you get your eyes examined regularly, and your doctor spots the early warning signs before you notice any vision changes, the progression can be stopped. Blood sugar control can prevent further damage. Laser treatments can seal leaking blood vessels. Injections can reduce swelling and stop abnormal vessel growth. But you have to know the warning signs. You have to take them seriously. Helen, the patient I told you about, was fortunate. We caught her diabetic retinopathy before she lost significant vision. We got her diabetes under control with medication and major dietary changes. An ophthalmologist treated her eyes with laser photocoagulation to stop the bleeding vessels. 2 years later, her vision is stable. But she told me something that stayed with me. She said if she had known that those floaters were a warning sign, if someone had told her that new floaters mean you need to see a doctor immediately, she would have come in a year earlier. She would have caught the diabetes before it damaged her eyes. She would have avoided the fear, the treatments, the permanent changes to her retinas. Now, let me talk about another eye warning sign that appears after 50 and predicts serious cardiovascular problems. This one you can actually see yourself without any special equipment. Look in a mirror right now. Look closely at the whites of your eyes. Do you see red lines? Visible blood vessels? More than you used to see when you were younger? Most people dismiss this as eye strain, lack of sleep, allergies, or just normal aging. But persistent redness in the whites of your eyes, especially if it is worse in the morning or getting progressively more noticeable over months and years, can be a sign of high blood pressure damaging the blood vessels in your eyes. When your blood pressure is chronically elevated, the increased pressure inside your arteries causes the vessel walls to thicken and narrow. This happens in the blood vessels throughout your body, including in your eyes. The vessels in the whites of your eyes, the conjunctiva and the episclera, can become engorged, dilated, more visible. They can rupture, causing subconjunctival hemorrhages, those alarming bright red patches that appear suddenly in the white of your eye and can last for weeks before the blood is reabsorbed. More concerning, the blood vessels in your retina respond to high blood pressure by constricting, narrowing, trying to protect the delicate retinal tissue from the excess pressure. But this narrowing reduces blood flow. It starves the retina of oxygen, and over time, chronic high blood pressure causes the retinal arteries to develop changes that an eye doctor can see clearly during an examination. The vessels become narrower. They develop areas of irregularity. The crossing points where arteries pass over veins start to compress the veins, a sign called arteriovenous nicking. In severe cases, the optic nerve can swell from the pressure, a condition called papilledema that indicates dangerously high blood pressure that requires emergency treatment. I had a patient, a man in his mid-60s named Thomas, who came to see me because he kept getting bright red patches in his eyes. He said it would happen every few weeks. He would wake up in the morning, look in the mirror, and one eye would have a large red area in the white part. It looked dramatic, almost frightening, but it did not hurt, and his vision was not affected. He thought maybe he was rubbing his eyes in his sleep, or that his eyes were just dry. When I checked Thomas's blood pressure, it was 180 over 110. That is stage 2 hypertension, dangerously high. And when I examined his eyes, I could see the damage that high blood pressure had been causing for probably years. His retinal arteries were narrowed. There were areas of arteriovenous nicking. There were small hemorrhages and
Cotton wool spots, which are areas where blocked blood vessels had caused localized retinal damage. Thomas had been walking around with severe hypertension, completely unaware, and his eyes had been trying to warn him with those recurrent red patches every time a fragile, damaged blood vessel ruptured from the pressure. We started Thomas on blood pressure medication
immediately. We scheduled regular follow-ups. Within 6 months, his blood pressure was controlled, and the red patches in his eyes stopped appearing. But the damage to his retinal blood vessels was permanent. The narrowing, the nicking, those changes are irreversible, and every one of those changes increases his risk of retinal vein occlusion, a condition where a vein in the retina becomes completely blocked, causing sudden, painless vision loss that can be permanent. Now let me talk about another eye warning sign that is incredibly common after the age of 50 and that most people completely ignore because they do not realize what it means. This is a yellow or white ring that appears around the colored part of your eye, around your iris, right at the edge where the iris meets the white of the eye. It is called arcus senilis, or corneal arcus. It looks like a faint, thin ring, sometimes complete all the way around, sometimes just a partial arc. And almost everyone over 70 has some degree of it. Most doctors will tell you that arcus senilis is completely benign, completely normal with aging, nothing to worry about. And in people over 70, that is generally true. But when arcus senilis appears in people in their 50s and early 60s, when it appears prematurely, it is a warning sign that should not be ignored. That ring is made of cholesterol and lipid deposits that have accumulated in the cornea. And premature arcus senilis, appearing before age 70, is strongly associated with high cholesterol, high triglycerides, and increased risk of cardiovascular disease. Multiple studies have shown that people with premature corneal arcus have significantly higher rates of heart attack and stroke compared to people the same age without it. The cholesterol deposits in your cornea are a visible marker of what is happening in your arteries throughout your body. If cholesterol is depositing in your cornea, it is depositing in your carotid arteries, your coronary arteries, your cerebral arteries. It is building up as plaque that narrows your blood vessels and sets the stage for a cardiovascular event. I treated a patient last year, a woman in her late 50s named Margaret, who mentioned during a routine physical that she had noticed a white ring around her eyes and wondered if it was cataracts starting to form. When I examined her, I immediately recognized it as corneal arcus. It was quite pronounced for someone her age. I ordered a lipid panel. Her total cholesterol was 320 milligrams per deciliter. Her LDL, the bad cholesterol, was 240. Her triglycerides were over 400. She had severe dyslipidemia and did not know it because she felt fine. No symptoms, no chest pain, no shortness of breath, nothing. Just a ring around her eyes that she thought was normal aging. We started Margaret on statin medication to lower her cholesterol. We made major changes to her diet. We scheduled a cardiac workup, including a calcium score CT scan, to see if she already had plaque buildup in her coronary arteries. The scan showed moderate calcification. She already had atherosclerosis. At 58 years old, she was well on her way to a heart attack. And the first clue, the first warning her body gave her, was that white ring around her iris that she almost did not mention. here is what I need you to understand. Your eyes are not isolated organs. They are connected to your entire circulatory system, your metabolic system, your nervous system. Everything that affects your overall health affects your eyes. And because the blood vessels in your eyes are so small and so visible, they show damage earlier than almost anywhere else in your body. High blood sugar damages eye vessels before it damages kidney vessels or heart vessels. High blood pressure causes visible changes in retinal arteries before it causes noticeable symptoms elsewhere. High cholesterol deposits in your cornea before you have chest pain from coronary artery disease. Your eyes are giving you advance warning. They are showing you what is coming if you do not make changes. And the tragedy is that most people either do not notice these warning signs or they dismiss them as unimportant. Floaters are just floaters. Red eyes are just tiredness. A ring around the iris is just aging. But they are not just those things. They are your body trying to communicate with you. They are measurable, visible markers of processes that are damaging your health right now, in this moment, while you feel completely fine. Now, let me talk about what you should actually do with this information, because awareness without action does not help anyone. First, you need to get a comprehensive eye examination every single year after the age of 50. Not just a vision test where you read letters on a chart. A comprehensive examination where your eyes are dilated and an eye care professional examines your retinas, your optic nerves, your blood vessels. This examination can detect diabetic retinopathy, hypertensive retinopathy, glaucoma, macular degeneration, and dozens of other conditions in their earliest stages when they are still treatable. If you have diabetes or prediabetes, you need to get your eyes examined every year without fail. If you have high blood pressure, you need annual eye exams. If you have high cholesterol, you need annual eye exams. If you are over 60, you need annual eye exams regardless of whether you have any risk factors. This is not optional. This is preventative medicine. This is catching problems before they destroy your vision. Second, you need to pay attention to changes in your vision and your eyes. New floaters, especially if they appear suddenly or are accompanied by flashes of light, require immediate evaluation. A sudden increase in the number of floaters can indicate a retinal tear or detachment, which is a medical emergency. Persistent red eyes, especially if they keep recurring, need to be evaluated. Sudden vision loss, even if it resolves within minutes or hours, can be a warning sign of an impending stroke. Blurry vision that comes and goes can be related to blood sugar fluctuations. Do not ignore these signs. Do not wait to see if they go away on their own. Get evaluated. Third, you need to control the underlying conditions that damage your eyes. If you have diabetes, your blood sugar needs to be controlled, period. And hemoglobin A1C above 7% is damaging your eyes, your kidneys, your nerves, your arteries every single day. If you have high blood pressure, it needs to be treated. Target blood pressure for most people over 50 is below 130/80. If you have high cholesterol, especially if you already have cardiovascular disease or multiple risk factors, you may need medication in addition to diet and lifestyle changes. And fourth, you need to protect your eyes from additional damage. This means wearing sunglasses that block ultraviolet light whenever you are outside during the day. UV exposure accelerates cataract formation and contributes to macular degeneration. This means not smoking. Smoking dramatically increases the risk of macular degeneration, cataracts, and damage to the optic nerve. This means eating a diet rich in leafy greens, colorful vegetables, and omega-3 fatty acids from fish, all of which support retinal health and reduce inflammation. Let me share one more patient story, because this one illustrates how powerful early detection can be. I had a patient, a gentleman in his early 70s named Richard, who came in for a routine physical. No complaints. Felt great, played golf 3 times a week. But during his eye exam, I noticed something concerning. There were yellowish deposits in his retinas called drusen. Drusen are one of the earliest signs of age-related macular degeneration. the leading cause of severe vision loss in people over 60. Richard had no symptoms. His vision was perfect, but those drusen meant he was at high risk of developing the wet form of macular degeneration, where abnormal blood vessels grow under the retina and leak, causing rapid vision loss. We referred Richard to a retinal specialist who monitored him closely. We started him on specific supplements that have been shown in large clinical trials to slow the progression of macular degeneration. AREDS 2 formula vitamins with lutein, zeaxanthin, vitamin C, vitamin E, zinc, copper. We taught him to monitor his own vision at home using an Amsler grid, a simple chart that can detect subtle changes in central vision. And we educated him about the symptoms of wet macular degeneration, so he would know to seek immediate treatment if they appeared. 3 years later, Richard developed wet macular degeneration in one eye. But because we had been monitoring him so closely, because he knew what to watch for, he came in within 48 hours of noticing that straight lines looked slightly wavy on his Amsler grid. We got him treated with anti-VEG injections immediately. His vision was saved. If we had not detected those drusen early, if he had not been monitored and educated, he would have waited until his vision was significantly impaired before seeking help. And by then, the damage would have been permanent. This is what I am trying to help you avoid: preventable blindness, preventable vision loss, preventable complications from diabetes, hypertension, high cholesterol, all of which show up in your eyes before they show up anywhere else. Your eyes are talking to you. They are showing you warning signs. And if you pay attention, if you get regular exams, if you take action when problems are detected early, you can preserve your vision for the rest of your life. I know this has been a lot of information. I know it might feel overwhelming, but I want you to walk away from this video with 3 simple action steps. 1. Schedule a comprehensive eye examination if you have not had one in the past year. 2. Pay attention to any changes in your vision or the appearance of your eyes, and do not ignore them. And 3. Make sure your blood sugar, blood pressure, and cholesterol are being monitored and controlled. These 3 steps will protect your vision and your overall health more than anything else you can do. Now, here is what I need from you before you go. I need you to like this video right now. I need you to subscribe to this channel because I make videos like this every single week. Videos about the warning signs your body is giving you, the preventive steps you can take, the information your doctor does not have time to explain in a standard appointment. And I need you to leave me a comment. Tell me if you have noticed any of these eye warning signs. Tell me when your last comprehensive eye exam was. Tell me what other health topics you want me to cover. Your engagement helps this message reach more people who desperately need this information. I truly hope this information helps you take better care of yourself and the people you love. Protecting your vision is not just about being able to see. It is about protecting your independence, your quality of life, your ability to do the things you love for as long as you live. Your eyes are precious, they are fragile, and they are trying to warn you when something is wrong. Listen to them, take care of them, and they will take care of you. Take care of yourself, and I will see you in the next video.